Hello. Welcome to another episode of Disruption Talks, where we invite industry leaders to discuss digital acceleration, innovation, winning strategies, and product scaling. My name is Aga. I'm a client partner here at NetGuru, and I'm very thrilled about digital health. So I'm very excited today to host Danma, Head of Innovation Lab Sandoz, Germany. Welcome.
Thank you, Aga.
Very exciting to have you today. And thank you so much for finding time. We are thrilled that you found time in your schedule to have this conversation today with us. So I think that the best way to kick off would be to actually find out what your role in Sandoz is about. If you could guide us a little bit more about what exactly it is that you do and what career path led you there.
Okay, happy to. Thank you so much for the opportunity to speak about a topic that's really close to my heart. So I'm happy to make the time. And yeah, my name is Dan. I'm heading the Sandoz Innovation Lab in Germany. And my team is mainly responsible to drive partnership, mainly with startup in the field of digital health. And how I got here is pretty straightforward. So I'm a molecular biotechnologist by training, studied in Heidelberg in London, and pretty much found out that I'm not probably going to be a kick-ass lab scientist. My personality was a little different. So I started my professional career actually at a management consulting at Bain & Company, mostly working for clients in healthcare and private equity space. And then I had a friend who left Bain and joined Sandoz, and she kept telling me about this generic leading company who has the vision to, provide high quality, affordable medicine. And that was something that really resonated with me personally, and also about the culture, that it was fast paced and agile. So when I was ready to make the next move, naturally Sandoz came to my mind, and that's how I joined Sandoz 12 years ago, first in a strategy role. And very soon, I really wanted to get down to operations. So I went into a product management role and was very soon given the opportunity to lead a commercial team, first in the area of nephrology and then endocrinology, and then a different other areas. Last was oncology. And then COVID hit us all, right? And during that time, I realized that digital is so important, and I really wanted to take a step back and really understand, okay, what does digital actually mean, and what's a strategic sense behind that. And I was lucky that I was given the opportunity first on a project level to do an assignment, define a digital health strategy for Germany. And I absolutely fell in love with this topic. So I think it's not a project, it's really a different way to look at it. And luckily, I was given the opportunity to shape the role that I'm in today and founded the Sandoz Innovation Lab. And yeah, that's probably the great thing about Sandoz, that I was always given the right opportunity at the right time. And that's why I'm still around after 12 years.
That's really interesting to see, like from being very domain specific and then consulting, and then being able to marry the two, especially with such an event as COVID that has put a challenge, and changed the status quo of so many things. So thank you for leading us through this. Actually, when we were talking about having this interview, and I was thinking what angles would be interesting to explore from the innovation side and your company, especially from our audience that is maybe not as familiar with digital health specifically, what came to my mind is that innovation in pharma and life sciences is often associated with research and development, with patents especially, and brand protected therapies, right? So knowing that Sandoz is focused on generic medicine that is accessible, widely accessible, as you mentioned, definitely a subject that one can be passionate about. Can you tell us how you find your angle on innovation, marrying the two seemingly opposite direction?
That's actually a question I often get, especially at conferences when it comes to innovation. It seems the common misconception that generics and innovation are contradicting each other. I think actually that innovation is so much broader than on product level itself. Obviously, by the business model, yes, as a generic manufacturer, we are not developing novel therapies. But there are so much more dimension where innovation can happen. In my definition, innovation is just trying to do things differently and bring in additional value. And that comes a lot in commercial innovation, but also on the process side. Actually, the vision of Sandoz is pioneering access for patient, and there's a really strong heritage in doing that. And a good example is actually the biosimilar story. So biosimilar was a novel class of molecule when it first came to the market, and there was like no real access process for it, how it became, accessible for everyone. And Sandoz actually worked very closely with the authorities in Europe and US to actively shape that process and launch the first biosimilar, which is Omnitrope, a growth hormone, and a product that's very dear to my heart because I had the honor of leading the commercial team for a year. It's a growth hormone to help children grow to their full potential. So cannot be more rewarding. And that was the first product that has been launched. And since then, there are, I think, 10 biosimilar currently marketed and 24 that are currently in the pipeline. So I think the biosimilar story really shows how you can, bring innovation in a different way. I see digital health actually, you have
I think we're having some technical issues.
Opportunity to shape the market through real-world evidence. Can you hear me?
Now it's better, yes. Can you please repeat the last sentence, because we ran into a little bit of a technical lag. Can you hear me?
Okay. Yes, I can hear you just fine. I hope you caught what I said.
Yes. Definitely very exciting area about making the drugs accessible. The example that you've mentioned, I don't think anything can be more compelling. And I love that we touch upon this, like where the impact lies, that it doesn't necessarily, actually in entrepreneurship, it's often like the famous sentence that the idea doesn't matter, execution matters. So I think that innovating further down the value chain is as impactful, if not more, than coming up with new ideas that, of course, we need, right? No discussion there. And we actually in NetGuru have been fortunate enough to work on a project like that as well. We've worked on the patent opposition database with Doctors Without Borders. So definitely something that I kept in mind as one of the areas I was excited we're talking with you and Sandoz today. And another topic that I wanted to tie to our company culture is position of women. Being a B Corp, it is a subject that we address a lot with our employees and in general. Can you, as a woman who have developed her career into the executive position in such demanding industry as pharma, share your insights on what could empower women to access leadership roles in tech and innovation areas?
Sure. So first of all, congratulations. I didn't know NetGuru was part of B Corp. That's really cool. And I guess coming from a pharmaceutical industry and working in digital health, maybe I'm a little bit spoiled when it comes to gender ratio. I feel like we are probably a bit more advantaged in that field than other tech industries. So at Sandoz, I never felt underrepresented it as a woman. If I look through my peer group and even in my the management team, I think we have today even 5 female leaders at the C level at Sandoz. So it was always it was never a huge issue, and it's not just for gender but also in terms of ethnicity and background. I always felt, and that's part of the culture that I love, I've always felt included. When it comes to innovation, and that's probably going to be a little provocative, I actually think that women to be, I mean, there are more inspiring women that I see in driving innovation than men. And maybe an anecdote from my personal experiences. So we run the Sandoz Innovation Lab on a hybrid rotation-based model. So we have 3 spots that we allow associates from different area to come to my team for half a year and get the spirit and take that experience to other teams. And we've finalized like 9 rotations so far, and maybe in total about 15 people who were interested in joining us. And we have people from very different areas, different background, different age range. The only aspect that's not diverse is they were exclusively female. And at one point I was a little frustrated. I thought, like, what is wrong with me? And I actually talked to our D&I champion, Martin. If you're listening to this, Martin, I said, Martin, why can't I get any guys? And he was a little uncomfortable. And I said, for the Sandoz Innovation Lab. And he's like, oh, okay, let's brainstorm on that. And I think some of the points that we come to a conclusion was that I think women are just more curious, especially when it comes to digital. We actually see statistics that digital adaptation is stronger among female than male in general. And I think that driven by that curiosity, women tend to be more passionate and purpose-driven in how they follow their goals. So if they're interested, they're willing to invest their time, even their personal time, to get into the topic, even though it doesn't necessarily bring them immediate career benefit in that second. And I think that's a good reason. And the third reason for innovation is that women probably don't tend to have a strong ego or as large as an ego in sometimes, right? And if you don't think you're the center of universe, it's much easier to work with a partner, because then it's not your ideas, but it's the shared ideas that get implemented. So I think they're female, and I'm happy if you don't agree among the audience and I'm sure there are more male leaders, then please reach out. I'd love to get to know you. And how can we do to empower women? I think coach young talents on self-confidence early on, and tell them not to undersell themselves, give them the stage to help them share, give them the visibility to shine, and hopefully be a good role model, and tell them that you can be a great mother and a great leader, and you don't have to decide on each.
Absolutely, that is definitely this Saint Grail, right? To approach, but that is fascinating what you've shared about the ratio and about like never feeling the lack of women, because the perspective that I encounter in either research or opinions of other women in different professions is that they have a little bit of minority vibe. So that is definitely a great voice to hear, that like it is not maybe as much, or that we are not as limited as we may be used to thinking and considering ourselves to be, right? So I'm very happy that we are on this optimistic, you are like sharing optimistic angles, because I wanted to move the conversation to the environment that you're dealing with, the industry that you're dealing with on everyday basis, which is digital health in Germany. So a subject that is quite known to be challenging. So I am curious if you would have, what is your look and perspective on the industry today? And also if you would have any optimistic examples of, like what is exciting now and what is, like going to move things forward.
Okay, I try to be anti-German, so very optimistic. But still, I mean, we are not known to be probably the fast mover as Germany among all other countries in terms of digital transformation. I think there are more European countries, the smaller ones mostly, the Nordics, the Eastern European countries, but also UK and Netherlands and even US and other geographies. I think they are all much more digitized than we are. And I guess a very live example is until last year, we still had the prescription on a pink sheet of paper, which I think is not seen in many other countries anymore. And we often put that on the complexity of the German system, and it certainly is our risk-averse mindset that holds us back in, just trying things out sometimes. But I see that the pain in the system is getting bigger as the costs rise, as the staff shortage becomes more urgent. So I'm hoping that we're using actually this pain to move the needle forward. And I do see that there are more voices from across different stakeholder groups that are advocating for more disruptive changes. And I think the technology that we see today is just an enabler that will help us, get to the better solution faster. And because you wanted to ask for more specific development, so this year we actually passed 2 laws. The German name is DGG and GDNG. So basically Health Act and the Health Data Usage Act. And I think these are the important foundations, right? The regulatory foundation that will then trigger a lot of infrastructural change. So the e-prescription, as I mentioned, has become mandatory. And I think as of now, we already see that 80% of the prescription is now digital after the 3rd attempt. And the electronic patient record is becoming mandatory by 2025. And I think these 2 development actually triggers a lot of innovation potential, because then once the data is digitized, you have a better access, and that is the foundation for the next level of digital care and finally also personalized medicine. So I think this just opens up a lot of opportunities for innovation. And I already see that there are more venture money coming in. So there was a huge announcement last week that the HEAL Capital 2 fund was set up. So that's a fund funded by private health insurance over 100 million. And they want to target the segment of scale up and startup and help them, bring innovation to the market. So I hope now we're entering a phase where we see more capital coming in, more entrepreneur trying to grow their business model in the German market. And it's still a long way to go. And as an impatient person, I always hope it gets faster done than what we see, but there is certainly hope.
Absolutely, there is, and the changes that you've mentioned are very promising. It seems like both the funding and the legislation can be a very strong push and accelerator. Definitely, when you just mentioned about like the paper prescription, the difference between regions is so tremendous. Like with adoption, I remember when I was in Norway in the beginning of 2000s. I first went to the doctor and I heard that I can just pick up my medicine, like in the pharmacy, and I needed no paper because everything was attached to my ID number, right? Mm-hmm. So that was 20 years ago. And it's just amazing how we can see that something is available on one market, but somehow it doesn't make it to the other. But the speed, like from 0 to 80% is also extremely promising. So that's very, very cool. Thank you for sharing the optimistic side. I am a believer that we will be seeing very promising and very interesting projects in Germany in digital health soon. So I'm always looking for confirmation. So thank you for that. And zooming a little bit into Sandoz itself, can you tell us a little bit more about how you foster culture of innovation, culture of thinking outside the box in your company?
Sure. And I think the first to mention is innovation doesn't only happen in the innovation lab. It's a much broader mindset. As I said, it's embedded in our vision to pioneer access. And it's really, I think, important that you get this endorsement from the top leadership team that you want to encourage people to think differently. One of our core values is actually open door, open minds. And more importantly, just the world is just, the how the leaders actually live to this value. Do they value, associates coming up with a different idea to challenge the status quo? And I always felt like we had that openness. And now, since Sandoz became independent, I feel like this entrepreneurial spirit is even more enhanced, that we do things. And what I and my team is trying to do is really, we are trying to bring in the external perspective and spark the curiosity by showing people what's happening out there, what cool business model is just being developed. And we do that. For example, we have a format called the monthly eHealth and Innovation session. And we start usually by inviting one external guest. Just, it could be a partner that we collaborate with, could be just an entrepreneur with a really cool model. And they give an impulse speech of 15 minutes. And then we follow up with our internal topics. But now, completed 20 sessions actually, and the audience group grew over time. We have a steady group of 50 people, and that's the good thing about this format. It's very open. We have board members joining us down to Salesforce and product manager. So everyone who is interested in getting an outside perspective can join. And we even have colleagues from other geographies who wanted to be on the mailing list. And that's the biggest encouragement for me, actually. If we actually get people interested, not just to find the solutions in-house, but really get sparked by, okay, what is happening out there? And our job is then to take that curiosity and then really understand how, this cool idea matches with our internal needs. So we need to understand what is the need of our business, our clients, but also our patient, and what is the pain point. And we need to ask this question over and over. It seems so simple, but really getting it to the in-depth level, that's really key, because you need to really understand the pain and then see the cool solutions, and then you can connect the dot. If you're just going for a cool solution, it's not tied to your priorities or the need, it just doesn't fly. That's my experience.
Yeah, it's is it what is often described solution looking for a problem?
Yeah.
Would that be a fair description? Yeah, exactly. That is like the 5 whys, right? Digging in and making sure that you remove noise from signal, and that you really discover where the issue is one thing, but that's inspiring dialogue. It's definitely also making a very friendly, innovation-friendly environment to work at for your employees. So that's very cool as well. So knowing that how you provide, or the Sandoz provides a platform to exchange ideas for everybody is one thing, but that you are in charge of the innovation lab. So this is your job to bring the innovation into the company. Can you tell us a little bit more about what model do you foster? Like, there are so many ways in which enterprises look for innovation in the market. Like, we have Mask Innovation Center that is looking to source startups and apply their solutions in-house so that their products, their operations may become more refined. And then you have Philips Ventures, for example, that is looking to invest into external innovation and just help foster some startups to become scale-ups, et cetera, et cetera. Which model do you champion?
As of today, the focus of Sandoz Innovation Lab is not to take equity or actively invest in startup, but really it's about driving win-win partnership. So we look for the right solution that fits best to the needs that I was trying to explain to our business, but our customer and patient. And I think the value proposition that we bring in is that we really understand the industry super well, the needs. And then when we see a solution, we can work together and co-create and refine that solution so that it really is fit for the purpose. And we have the access to the customers, and we can help the innovations to scale. So it's not really about reinventing the wheel as innovation, but really see a raw diamond and polish it until it gets shine. And I think personally, actually, this is the harder part. So finding a good concept, making it work, that's one thing, but really implementing that, I think that's the king discipline, as I would call it, because that's a lot of the times what I see, and when I exchange thoughts with my colleagues in Innovation Lab, where a lot of things just don't happen. And I think really making sure that you're able to execute what you define and execute with speed, that is super key. And that is actually the biggest learning in the last 2 years for me, how to make that happen.
From a perspective of somebody who's been involved in the startups and looking into the digital health specifically, one of the biggest obstacles is how to access the market, right? It is such a regulated industry where stakes are so high and the ecosystem is so complex that being able to access a larger partner is very often make it or break it, So I think that just by, having this interface that you're open to build partnerships and probably provide your expertise and maybe guide some pilots, it is such a value in itself for, the development of the scene, of the startup scene. So that's very cool. Can you share any memorable projects that you've, partnership projects that you've worked on?
Well, so we've implemented, I think, more than 15 different partnerships across different business area at different scale. But probably the most complex and bigger at scale, and that I personally felt most attached was the partnership with a scale up from the Netherlands called Care Animation. Their flagship product is basically a digitized package leaflets. The package leaflets, which is super small and written in a very specific way that not a lot of people understand. They managed to transform that into animated video and easy to understand language. And they also did a one-pager with pictograms in 48 languages, I want to say. And they did that for the majority of the portfolio. So that's something that is already running super smoothly in Netherlands. It's embedded as a standard of care in Dutch pharmacies, and it actually get reimbursed from the from the health insurances, because they see that the patient who see the video actually understand much better how they are supposed to take the medicine, the compliance raises, and therefore the follow-up costs. So it was a really great success case in Netherlands. When they wanted to enter a German market, which is much more complex, the access was a difficult topic. And so they were looking for a partner with a good access, but also a good understanding of the needs of the German market. And from my perspective, from our perspective, for Germany, it was a perfect match. As I said, we were, really passionate about pioneering access and helping the patient understand how they are supposed to take the drug and not just delivering the drug. I think was really resonating well with what we are trying to do. And their service is not targeted on one product, one therapy, but across the portfolio, not just Sandoz, but overall. So that really fits also with our holistic approach. And so therefore, based on the strategic fit, we pitched that to our management team, and we did quite a big commitment that we would actually detail that service through our own field force to the pharmacies. And we did it like it was our own product. So I thought that was tremendous that we committed to that. It was not the pilotitis. We do it with a small thing, but we really go all in because we see the sense behind it. And also from a personal perspective, I was really impressed by the founder, Rob. He had such a strong vision to really step change healthcare. And that's why we had a great personal connection. And that's why I could call him at 11 at night. And sometimes we would call at 7 a.m. in the morning. And I think that was, from personal perspective, what was so great. And I learned so much.
So you experienced founders, like a working hours schedule. That's a special one for sure, and the commitment as well. Wonderful idea that not only removes the clutter and is very eco-friendly, but also the shift. It reminds me of a shift from hardware to software. Like hardware, there is a famous sentence: hardware is hard, because the iterations are so difficult, right? Once you release it to the market, it's so difficult to get it back, right? And we had these patches, for example, for software on CDs some time ago. But, like making this shift, like not only allows you to iterate and improve, like product with patients, but also make sure, like improve the access of patients to, information that they may need ad hoc. Maybe they've noticed some symptoms that they didn't have like first month of taking the drug. They removed the leaflet long time ago, and now they can have access to it. So really, really cool, cool innovation. We actually have, I'm seeing a question from the audience. How exciting. So I actually wanted to touch upon challenges for startups and corporates, but the question that we have is, Dan, what's the greatest blocker to an innovation mindset in your opinion? How can leaders foster an open approach?
Well, I think as a business leader, you always have to make a trade-off between what's important now, what's the driver for your business success today, and what's the future trend. And it's very difficult to foresee how fast a trend is accelerating. So you kind of have to do what's right today, and you have to prepare for tomorrow, but your resources are limited, right? So you have to find that right balance. And I think that having been in that position myself, is much easier in theory than in practice. And also when you have a team that's used to do things a way which often is just how we have done it. So if you have a very stable team, it's great that you have a lot of expertise, but you may not have as open mindset to change. So I think as a leader, you can foster a better approach to have a good mix of experienced members, but also people from different team, maybe doing a rotation principle. So you always get to look at a new angle. Also for myself, I don't think I'm going to run the Innovation Lab forever, because I think it's really time that somebody else also take a spin on it and see stuff that I just don't see anymore after a couple of years. So I think taking your personal ego back, letting new ideas coming in, and trying to remind yourself it's not just what is important today, but how to find the balance to bring in some of the stuff that's going to matter tomorrow. That's probably the two things I see.
For sure. I think that, I personally subscribe to, like this external perspective, and like this like external look into something, and how a person from outside not only can, like see something that is like less obvious, but has been a norm for the team, like, and share their perspective, but also bring their experience, right? So we've seen how, I don't know, technologies like blockchain, for example, has been developing in one area more, like finance, I think was definitely the breakthrough area. And then other industries now are adopting, like the technology that has developed primarily somewhere else. So that is a very, very good tip.
And if we take that further, and to your question, that what you were about to ask, the hurdles for implementation, I think that's the next step. Not just bringing in fresh people from different departments and teams, but also really going external and taking the views from external partners, and trying to merge that with your own strategy. I think that's the next level that we need to hit.
That's a great tip. Our time is coming to an end, so I would like to wrap up with the very future-oriented question. How do you see the market evolving in the next 3 to 5 years? Where do you see biggest changes happening?
Okay, so I'm going to stay with the optimism. And for me, I see changes on different levels. So on the business side, for me, I hope that digital health will leave this innovation playground, and it will not just be the cool new thing that we are trying, but I hope that digital health will become a central driver for the business strategy. So whenever we start to enter a new therapy area, a new product launch, I think we should think about, okay, what is the digital technology? How can it help us to identify the patient, to help with the compliance of the therapy, and to get to the holistic picture at the end, how we treat the patient better. So that's the first level. The second level, I do hope for the patient that digital technology will just give us much more transparency on what we are doing. Because if you have been a patient, unfortunately, I have been the last couple of months, the family member of patients myself. So you feel like you're always waiting for information. You're not knowing what's happening in the background, and that's very unsettling. And I think the digital technology just enables us to get that level of transparency and feel more empowered to actually ask the right questions and take care of our own health. And by doing that, I really also hope that we gain more trust from the people to share that data and to get into this positive spiral that it's not something dangerous, but it's something that actually helps us to advance science. And then again, on the society level, I do hope as Germany, we become less skeptical and less risk averse when we deal with new data and new technology. And I do hope that we will find the right balance with AI, that on the one hand, we get help us free from the administrative burden that we still suffer today, but also that we use the spare capacity that helps us not just to save costs, but really to deliver a more human-centric healthcare. That would be my dream come true.
That is brilliant. And I really hope that there are signs already, Germany investing so much into fostering innovation startups, innovation ecosystem startups, that I hope that the momentum is set, so I really am looking forward to these changes and to staying in touch and seeing the developments in Sandoz. Thank you so much for the conversation today. It was lovely. And yes, welcome to the next episode. Thank you.
Thank you, Aga. It was my pleasure.